Good afternoon, everyone. This is Megan Fournier with the Home Care Alliance Massachusetts. I just wanted to go over a couple of details before we started today's webinar with Michelle Thomas. First of all, you will be in mute only just for the sake of distractions and outside noises. Questions can be written out in the questions tab on the sidebar, and we will address them at the end. But again, if you have any that you don't want to forget, you can write them prior to, and we'll just keep track of them and answer them in order. And also, this webinar is being recorded, so if you want to listen to it again, or you have a staff member that you feel this would benefit, or you have to leave early or anything of that sort, it'll be sent out most likely this afternoon or tomorrow morning whenever it's finished being processed. I believe that's all I have for the time being, so without further ado, I'm going to hand it over to our speaker today, Michelle Thomas.
Hello, everyone. And first of all, using data to increase revenue and decrease expenses is not something that I grew up kind of doing. And we're going to talk a little bit about my background in the beginning and where I'm from and why we started doing this. I've been in home care for about 22 years. I started as a sales rep, going out, getting business, working with the agency, and eventually moved into operations. I was in Florida. I worked as the president of a company called Family Home Health Services, a Medicare agency. And while I was president, we were sold to an equity firm. And I wasn't really sure about this equity firm and how things were going to work with changing from a mom and pop that had grown into 14 agencies and 14 branches and really kind of hit the ground running to now this equity firm buying us, who also owned like SpaceX and Tesla and a bunch of other things that I didn't really think had a lot to do with home care. So I took what I could get from these guys and learned so much. And that is how I really started using this data. We had people come in and show us how to use dashboards and take data and move it into areas that was understandable not only to management but staff, so that on a daily basis we could use this information to really, from increasing revenue and private to looking at wraps and finals and all of the stuff on the Medicare side. So I stayed with family for another few years and was recruited away to the company that I'm with now, called Osborne Home Care. And we're in Rye, New York. We're a pretty large agency. We have about 450 employees. 420 of those are home health aides. We do about 15,000 hours of home care a week. And you're going to see how that breaks down on this dashboard. The dashboard that you're going to see today is one that I made up based on the information that I needed, but it's really customizable and you can change it to whatever works for you. And I'll show you how to do that. And after the presentation, you will get this dashboard that you'll be able to play with on your own agency and kind of figure out what kind of data works for you. So the disclaimer for this is I am not a data geek person. I don't grab data and, look at it and spend all my days doing this, but I do spend about an hour a week compiling it so that all of our employees can use it. This was foreign to me, so it's pretty user-friendly. So we're going to get into it a little bit, and I'll show you the next slide. Basically, by the end of this session, I hope that you can go back to your understanding with the knowledge and understanding that you're going to know what the data is, you're going to be able to explain the benefits of tracking it, you're going to be able to quickly compile it by using this dashboard or something else that you can do yourself. You're going to find the places where you can find the data, because some agencies use a sophisticated software system. Some agencies that I talk to are still using spreadsheets and ledgers and books. So you can use this with whatever you use. If you do payroll, then you can put this dashboard together and make it useful to you. All right. So the next slide basically just talks about data. And I know what people say about data, that you can manipulate it into anything you want it to say. But once you get it in this form, it's not really manipulated. It really is about using it to run your business, to run not only your sales, but your scheduling and your operations and even your recruiting. So data are facts and statistics that we collect together for reference and analysis. And what we're really going to talk about is the analysis part of it, how we use this data to build our business. So where do we find it? Where can we get this data? And there are tons of places to get it. And all of these places I've seen and we've gotten data from at not only this Osborne Home Care, but with family and other agencies that I've talked to, from your intake sheets. You know, if you have an intake book that you put all your referrals and intakes and inquiries into, that's perfect. That's a great way to get data. Your referral logs, all your admission packets, so your admission paperwork, your payroll records, overtime, the rest of them, client, your software system. We use Matrix Care. And Matrix Care does have its own dashboard. Unfortunately, it's not as easy for me to use. I do get some of the information out of it. You just go onto the dashboard tab that they have and can compile some information. We also use our satisfaction surveys, our transfer summaries, and even transitional nursing notes and logs. So if you have any of that stuff, that's where you can get your data. And pretty much this is what it looks like when it comes in. Everything from payroll records up there on the left-hand corner to, honestly, ledgers. You do not have to have something sophisticated to compile the data that you need. It's right there in front of you. How you put it together is what's really going to make the difference. A lot of people ask how often I track the data and how often I look at it. Like I said, I only pull the information once a week. And it does take me about an hour, but in that hour, I'm also doing some of the analysis and looking at things and comparing things from last week and the week before. Here is how often I track things and when. So referrals, I track weekly, our admissions, our hours. Some people go by hours per week, some people go by hours per month. We happen to use how many billable hours we have each week. We're going to talk about how those billable hours translate into overtime tracking, even to your new hires, and how you can figure out who's working and who's not. So weekly, I track all of that top 7. Overtime, paid overtime by our clients, our billed hours, our employees' worked hours, our admissions, our referrals. On a monthly, I look at our readmissions, and that is primarily for our referral partners that we use. Sometimes we'll have people that ask us for this, whether it be a hospital or an ACO or somebody wants to know that. And it's important for us, just like the Medicare agencies, to really track those readmissions and make sure that when somebody asks us for the information, we've got it readily available for them. The last thing you want to say is, oh, I don't know. One thing that private has been known for is that readmission to the hospital. When something's going wrong and the aide is out at the home, we have a tendency to call the on-call, and the on-call says, send them to the ER. We're making some changes with that, really looking at the nurse being a huge part of the picture on the readmissions. So we track that monthly. We also track our paid overtime to make sure we didn't miss anything. And we'll talk about paid overtime when we get to that specific slide. We look at our actual versus budget. We are a not-for-profit, so we look at budget a lot. My prior company was a for-profit, so we looked more at the margin, but it's kind of the same thing. You're going to look at your expenses versus your margin and what's going out, and not-for-profit has a tendency to look at their actual versus budget. Quarterly, this has kind of changed a little bit. We started doing the Home Care Pulse satisfaction surveys, and it is something that we track monthly now and really dig into it. We've gotten a lot of great suggestions with the satisfaction surveys because we had some areas that weren't as good as some other things, and it revolved around our office staff. So we tried to figure out how we could do that. And when we get to that, if I don't bring it up, somebody remind me and we'll talk about some of the satisfaction. Our total billed hour, and then obviously our actual versus budget again. Yearly, we do a lot of analyzing with satisfaction surveys to make sure that our training is where we need it to be. We're training on the things that are actually in the satisfaction surveys and can adjust as we go. All right, so that's how often we track it. And then why we track. I mean, this was the most kind of one of those blatant stories of tracking data. These are our inquiries. We average between 20 and 25 inquiries a week. A lot of that has historically come from our website or Google search. I look at this every Tuesday. So after I get off this call, I'm going to do our dashboard. And the first Tuesday, I noticed we had very little traction on our website. There wasn't much going on with the website itself. So I, looked at it. I called, marketing. We looked at it a little bit, but it wasn't really something that we really paid attention to until the next week when you see there is absolutely no red, nothing. We had no website traction whatsoever. Not a single inquiry call came from our website. So at that point, we started thinking something must be wrong. So we called Google, we called the person who runs our website and said, listen, what can we do? What's going on? We need some help. They did pretty quickly get on it for us to figure out that there was another company, Osborn, Osborn, who had trademarked something within Google. Therefore, no traffic could go to our home care website, Osborn Home Care, because they had put a trademark on the name and it was being blocked by their trademark. So at that point, nothing happens immediately, but we were able to then start putting a lot of Facebook ads out with our directing people to our website, because that is where we could get the call to action. That's where we got the information. So not only did we do our website, we did our LinkedIn, we did all of our social media with funneling people to our website. Click here to the website, click here to the information page. And that started a little bit of traction, not much as you can see, until we could work through it and get it figured out. But it did help get people to our website. And we noticed that our social media picked up more as well as we put more attention into that and kind of killed two birds with one stone, if you will, knowing how important our website is, one thing, but knowing how important the social media then played into it was another huge thing. So this was one example that without this data and tracking it on a weekly basis, I don't know whether we would have been able to jump into action so quickly. It might have taken us a little while to figure out through referral logs and things like that, what happened to the referrals and why they dropped off. We are all so busy. I mean, I know every one of us, whether you have an agency that's got 400 employees or whether you've got, 40 employees or even 15 employees, you still are lean working it because you have to be. And unless you're looking at this kind of constantly, it's kind of like taking your blood pressure, every day you take it, you might not worry about if it goes up 1 or 2 because you're just watching that consistent, but then when you see something major change. So this was kind of the, I guess whatever that proved to my boss and my people here that, listen, this is something we have to do. We've got to start tracking this. We've got to make sure that we're on top of it. Okay, so that's my soapbox on the dashboard. I'm a firm believer due to things like this. So let's take a look at what I do. And this is a condensed version because I have a little bit more on my dashboard, but we're going to look at the 13 weeks. I always track 13 weeks. Don't ask me why. It's because somebody did it that way, and I guess I always have. So we have, basically, you could call us having 3 branches. We have a campus. I'm part of a CCRC. So we do have a large presence on our campus. It is about 50% of our business right here on campus, taking care of both the independent living, the assisted living, and then people that are coming out of the skilled nursing. We also have a small staffing part component to our business. So that is what's noted in the orange on this very first little teeny thing that you probably can't see much of. Then we have our community, Westchester community. Hours, as you can see, we plugged along pretty close to budget, and in the last few weeks, we went a little below budget. Our Connecticut branch is brand new. We've been there for about a year and a half, so we are just under budget, struggling to get up there. And then I have my total weekly hours. And this is something that not only I look at every week, but our executive management also looks at this every week to see where we're at. We track every inquiry, always. We track every admission and every discharge. We track our Connecticut inquiries. We also track our census to see where we're going, as far as the different levels of care on campus, and then our Westchester and Connecticut. I track my average hours per client, how many clients I serve, what my average pay per hour is for our employees, how many caregivers we pay for the week, the average hours that the caregivers get, and then the overtime, both the paid and not paid overtime. So this is a snapshot. We're going to go into a little bit of detail now. So we're going to compare it from when I started, or when we started doing this, until now, so that you can see the difference. Not that there was, there was significant growth, and I'm not saying that our significant growth happened because of this dashboard, but I will say it did contribute a lot to knowing where we were at, knowing where the dips and the valleys were coming, the inconsistencies of how things, the ebbs and the flows, I guess. It really did show us a lot of that type of thing. So our total weekly hours, and this is 2015. The first slide is 2015. We were, maxing out at about 9,500 hours, 9,000 hours, 9,500 hours. We were below budget most of the time. We started looking at things a little differently and how we grew, and in this little uphill climb, which we love to see. Unfortunately, there were a lot of uphills, downhills prior to this kind of looking at it. This was from this past September, is your right-hand side, and it is about, it's a little more consistent, although the numbers are a little bigger apart, so it might look different if we broke it down a little bit. But not only did we grow significantly, we really did get a control over what we were doing and stayed above budget. So that's one comparison. I think the next comparison on the inquiry calls really showed us where our business was coming from and where we needed to concentrate. This slide alone is how I got sales reps. I went to my supervisor and said, listen, I'd like to look at bringing on some sales reps. We've got great community awareness. We've got, some website traction. We're using some of those sites like Caring Homes and caring.com, but our true community related inquiries are incredibly low. So how do I, get some more community inquiries? And that's when we decided to hire a full-time sales rep. And our community inquiries did significantly go up and are continuing to go up every week. So those are the inquiries. Then we're going to do some comparing what we started using data now. So the billable hours, this is probably the most important part of the presentation. Billable hours, what you're tracking and how you're tracking it. So I track payroll hours minus any travel time, and we all have travel time for our aides going from one place to the next. Any interview time is one of those things that as an agency, we're trying to get away from. Sometimes we will have 3 or 4 aides out at interviews, and they, 3 hours each, and nobody pays for that. So we've talked to our clients and our clients' families that are asking for these interviews, and either we're doing a meet and greet, so we'll get 4 aides together. They'll all go at one time. It lessens the time that they're away. They all get to sit and talk, and it's a little less intimidating for our home health aides. And they all come back together, and then the client will give us feedback. And we've gone to using some Skype and some FaceTime with clients' families so that they get to see the aide, they get to ask the aide a few questions and talk to the aides. We're also looking at the possibility of doing videos with all of our aides. So a little bit on interviewing. Vacation and sick time are also minus the billable hours. So here's what we track the billable hours. We kind of see it on the other one, the staffing time. And I put every hour that we do that we are able to bill in here so that my agency can get credit for everything that we're doing when I'm talking to somebody. And then this is the total. Okay, so you might ask where we get this information from. You can get this from anything you use. So your ADP, your OPRs, your Excel spreadsheets, your ledgers, however you get report on payroll, then you can put this in the dashboard. Whatever your payroll report is, the one on the right is what we get for payroll. The one on the left is just an Excel spreadsheet that I looked up. But however you get report on payroll, however many hours the aide worked, times, less their travel time and their vacation time or anything like that, you can put this together. Okay, so we'll move on to inquiry calls. We track everything. We track every call that comes in. Even if we don't have a name, we put Jane Doe on it so that we know where things are coming from. We track the name, phone, who's calling, why they're calling, how they heard about us, and we always try to get the email. And remember I said that our satisfaction surveys were a bit lower in the office personnel, so the communication, there was something that people weren't getting with the communication. They felt like the office didn't communicate enough. And from what I understand from Home Care Pulse, it's a normal thing. That's one of the lowest benchmarks there are. So now when we work on it, something with somebody and really work with them on it, whether it be an inquiry or a scheduling issue or a client question and concern, we'll send them a little survey on SurveyMonkey. It's only 3 questions, and it simply asks, was the person that you spoke to on the phone kind and courteous? Did they answer your questions? And is there anything else we can do for you? This has honestly helped not only our, clients feeling like they're getting more contact with us, but also our employees are spending more time with clients working these issues out. Not that they weren't working them out before, but now they're spending a little extra time because they know that they're going to send this survey out afterwards. And it's been very well received with the clients' families and the people that are willing to do something like that. They've enjoyed the fact that we're, working hard to increase our satisfaction. So we always try to get everybody's email, at least to send them our brochure. So here's the inquiry logs, and you can get this from your referral logs, your intake sheets. If you use a CRM or any kind of other software, just pull the report and put this on. It really shows you, if nothing else, your hard work and how much you're really doing. I mean, out of every inquiry we get, not all of them come through, but you're still working really hard on all of those inquiries. So make sure you get every single one of them down, and you can follow up. We follow up with everybody a week after they call, and then again at 30 days, just to make sure that whoever they did choose, they're happy with, and that we're still thinking about them. And sometimes those clients revert over to being clients of ours just because they weren't, something didn't click maybe with the caregiver, or You know, they were impressed that we followed back up. It was the one thing that pushed them to go ahead and get the care versus not. So, and track all your inquiries. We track our admissions and our non-admissions. Our admissions by type, whether it came from the doctor's office, whether it's a full-time client, whether it's a management or a case management client, we call that TSS, or whether it's med management, medication management or case management. We also track all of our non-admissions and our reasons. It's really important for us to know why people are leaving us, and so that we can follow up and figure out, and it wasn't an issue or was it something that we could take care of in training. All right, and then our discharges and reasons, obviously. I think I just said that. So these are the clients served, and we have the different branches here, the New York and the Connecticut, broken down, and then our hours by client. So I like to see when things drop and when things raise, because you don't really know, right, why, unless you kind of look at what the hours are. When we started tracking the average hours per client, it was amazing to me that, you know, sometimes our clients are way down, however many clients we've got. We might have 260 one week and go down to 251, and we've lost 9 clients, but for some reason the hours went up. And it's because we've kind of hit a turn where our clients needed a lot more care and added on to their care. So it's really interesting once you get into it to, you know, navigate through it, I guess. Okay, so caregivers. Out of everything, we all want to know where the business comes from. We all want to know how we can get more, what we can do about it, how we, you know, get our bigger presence in the community and get our market share. But really, if there's anything that I've gotten out of the webinars that I've attended and the conferences that I've been through, it is all about the caregivers. Our caregivers are everything to us. And I see a mistake on this slide, I apologize, but caregivers are everything. I think somebody said at the last conference I went to that he who has the most caregivers will win. And although that's kind of, you know, tongue in cheek, it really is almost true. I have, right there, there's 375 caregivers working on a regular basis, 40 hours a week. We have 425 on our roster, and I could use 100 today to get rid of overtime and to get rid of, to really weed through the caregivers that we've got and make sure that we're delivering the product that we want. Caregivers, number of caregivers paid, there's a little kind of formula that I use with that. I look at my roster and I will, on every position I've had, there's 10% of your roster that isn't going to work for whatever reason. They're on maternity leave, they're on, you know, other leave, they're out of the country. 90% of our caregivers, I'm close to the New York City market. 90% of our caregivers live in the Bronx. They're from other countries. And when they leave us for a vacation, they're gone a month to 6 weeks. It's not just a couple-week vacation. So when I look at the roster and say there's 450 people on our roster, or 425 people on our roster, I know that 45 of those people, 45 to 50 of those people are not going to be working because of whatever leave they're on or whatever vacations they're on. So I have between, you know, 375 to 400 that I can work, that'll be working. And here's what we've got. We work approximately 375 caregivers every week. I put their average pay per hour here. We do have a very longevity in our staff, so a lot of our aides have been here a long time. A lot of our aides are making $15, $17 an hour as their regular wage because they've been here 19 years, 20 years. So our average pay is a little high compared to some of the other agencies that I've talked to. And then our average hours our caregivers are averaging, above 40 hours a week. For me as a manager, I look at that and it concerns me because that means our overtime is up. I have not been able to hit my budgeted overtime this year, but I'm watching it and I'm paying attention to it and I'm looking at it every week and we're working toward it. Last year, we actually did meet our weekly overtime budget of 10% the entire year. So this year, with an increase of business and less caregivers, I think this is what we're up against. And the laws that are constantly changing certainly are there to protect the worker. I don't know whether they've done everything that they envisioned they would do to help our caregivers. So that being said, I'll move over to overtime. Overtime is pretty simple. I just do overtime minus whatever the client pays. We are fortunate that our clients do pick up quite a bit of the overtime, about 500 hours a week, a little more, depending on the condition of the client. But this is the overtime chart. So if we're doing about 2,000 hours in overtime, I would hope that somebody's, the client's picking up half of that or 500 of that to get to where I need to get percentage-wise. We have been, like I said, pretty much over our 10% budget all year. And it's something that we work as an agency to correct. All right, so let's see where we're at. Okay, so using the dashboard, like I said, you're all going to get a copy of this dashboard. And let's talk for just a minute about who uses this dashboard. This is not just for me to spend an hour on Tuesday and I'm the only person that ever sees it and I sit over my desk and cry over it all the time. Our whole team uses this. So when I say it gets sent out to everybody, it gets sent out to our coordinators, it gets sent out to intake, it gets sent out to our support services, our nurses, not to mention the management staff here at the Osborne. And it's kind of cool that after seeing it and getting to know it and working with it for the last few years, we make changes and we'll change one part of the dashboard to reflect something that we need to focus on more. But now they have their own little dashboards and they work with the, whether it be in scheduling or coordinating our care, how quick they can get somebody on permanent case and how quickly, somebody who starts today, how long does it take them to get a permanent case? We know statistically if they don't get a permanent case in 2 weeks, they're gone. We never see them again. They want permanent work. So they keep track of all those folks. We just had a class yesterday that ended. So we had 9 new caregivers. All 9 of those caregivers left here with a schedule. And some of it wasn't their permanent schedule, but they're working with them today to get them on a permanent schedule. And that's kind of the coordinator's dashboard. And it's their own. They just took mine and, did their own thing with it. So using the dashboard, really super simple. It's an Excel spreadsheet that has a data set, and you can see where the arrow goes to the data set and the dashboard, 2 tabs. It's formatted for 13 weeks. You can cut and paste and add additional weeks. I have it down like column-wise versus rows because it was easier for me to use, but you could very easily extend it out to rows and do the same exact thing. The headings can certainly be changed to suit your needs. These are just what I put on, and you can make all kinds of customizations to it. The next one is the dashboard is the first tab. So this slide was really your data set. All your data goes in here with your budgets and your staffing hours and whatever hours you have. You might divide it into however many branches you've got. Then the second tab is the actual dashboard. So that's actually your first tab. And that's where all your tables are. You can change the look of this, even if, believe you me, I am not an Excel spreadsheet guru. I didn't even know anything about Excel until I started playing with it and looking at it. But you can go right to this recommended charts and really make pie charts, and you want to impress somebody, go play around with that and turn these into different kind of charts that are usable for you and your agency. it really is very customizable. You can make it different colors. There are more instructions with your template that you'll get, so you can look at that as well. And really, that is kind of all that I have, but I do want to take questions, and I know we've only gone for about 40 minutes, so we've got plenty of time for questions and things that, you know, if you have any questions about the agency or questions about, you know, how, if this works and how I would use it in certain instances, I'm happy to answer those questions. It's a lot different when you don't have the interaction from people. So I'm used to, you know, questions and things.
Thank you, Michelle. I just wanted to remind everyone that if you do have questions, you can write it into the sidebar under the questions tab, and we'll address them now. And kind of like Michelle was saying, sometimes, you know, no question is a stupid question. I think that it's going to be a value to everyone else as well as to how she's used this for different situations.
Absolutely, and I think it went a little fast. Like I said, this is the first time I've done it on a webinar. So without looking at people and kind of getting reaction, it's a little different.
Well, while we're waiting, just a reminder again, this was recorded. So if you need to go back and be reminded of anything, it will be sent out in an email either later this afternoon. And then also Michelle will send the dashboard for you all to use. So I'll send that in the same email. It looks like we just got a couple of questions. So the first one is, can you repeat who uses the dashboard and how it affects their workflow again?
Sure. So when we first started, it was really just myself and our supervisors. So the coordinating supervisor, the nursing supervisor, and the support supervisor that does all the intake. And as we started sending it out, the coordinators started looking at ways that they could use it, especially that how many caregivers are working and how many hours they're working. So the coordinators took it on to start looking at it differently. And we are going to start in 2018 tracking not only how many caregivers are working, but how many of them that started with the last 30, 60, and 90 days are working. So if we've had, you know, 40 people start in the last 60 days, how many people of those are working? So that was actually their idea, and they're working on putting that together. So as far as their workflow goes, I don't think it's something that they refer to every day, other than kind of they put it together, they work on it together with themselves, and then they can go back to it and see, okay, you know, this week, for some reason, we went really down on caregivers. Is there a reason? Does that answer the question?
Great. And then the next question we have is, we are monitoring these indicators monthly. Is there a reason that you're doing it weekly?
I think we started weekly because in my other position, there were some more pressing things, whether it be wraps and finals and things that had to do with Medicare money coming in. I do it weekly here because especially that inquiry and intake, if I had waited a month, then it really would have been probably 3 months before I could really get a hold of it and keep track of what was happening. If our referrals go down, it may be, you know, weeks before our business shows it, primarily because I don't know about other agencies, but it may take us a week or two before somebody's ready to start care. So they're in a rehab, or they're, you know, just talking it over with their family. If we didn't track a lot of this stuff on a weekly basis, then we would lose out on what I feel some not only potential business, but then the potential hours on, you know, why did the hours go down? Was there a reason? Did we have 4 deaths? Did we have 4 people that just were unhappy? So I think that's why, just to keep a closer eye on the metrics on a weekly basis.
Great. The next one is, ours is a small independent agency, private pay only, about 60 caregivers. Would you suggest that this type of data would be as valuable for us, or is there a threshold, say 150 or 200 caregivers, where that relative size of our agency would make this more practical?
Well, you know, we are 100% private pay. We don't have any Medicare, Medicaid, or insurance payers in our mix. So in that instance, I think it's really important to keep track. We keep track of Connecticut the same way. Connecticut to us is a branch, and we sit down with the folks in our Connecticut offices, and it's a small branch. It's got, you know, I think this week we had 1,200 hours. So it's a small branch compared to the other branch, and we keep the data just the same, separate for Connecticut, to look at it with our team. I don't think there's a threshold. There might be things that are more important to you than other things, and maybe it is that, you know, if we hire 4 caregivers on this month, are they all working? What is their average hours per week? I think that's important to know always, and who's paying for the hours over 40. As an agency, we usually will pick up the first 8 hours of overtime for our clients, especially when they're transitioning from, you know, needing more care. And then as the family gets more and more care, then we'll talk to them about the overtime. But I think it's important for any size to know specific things, maybe not all of it, but certainly some of the specifics.
Great. Do we have any other questions at this time? In the case of anyone's typing, Michelle, I just wanted to thank you very much for your time and being able to schedule this with us for our members to listen to. If anyone else has any questions, as you can see, Michelle's information is on this slide and will be given out with the slides, or you can contact myself and I can contact her as well.
Absolutely.
So Michelle, is there anything else that you wanted to add before we end today?
I just first want to say thank you to you, and so happy I could do it. And thank you to the attendees. This is a busy time of year. We're all busy not only at work, but, you know, with family obligations and things. So to take some time out for yourself and think about different things, I think is commendable.
Well, thank you so much, and thank you all for listening in. If there's any questions that you think of afterwards, we're both available. So thank you all, and happy holidays, and have a great rest of your week.
Happy holidays.
Thank you.